chronic osteomyelitis, or what is called chronic after acute osteomyelitis. As incidence, this disease is rare nowadays due to wide use of antibiotic. Nowadays, chronic osteomyelitis usually complicate open fracture or complicate bone operations like introduction of intramedullary nail, patent screw, prosthesis in hemiarthroplasty or arthroplasty, etc. What is the etiology of chronic osteomyelitis? Predisposing factor, first of all, and the most important, is bad management of acute osteomyelitis. We said in the previous videos that the proper treatment of acute osteomyelitis depends on early, adequate, proper antibiotics in proper dose, and very early antibiotic, very early drainage. If inadequate antibiotics, no early antibiotic, no proper dose of antibiotic, no proper drainage, neglected cavities, and neglected sequestrum, neglected necrotic tissue. All this bad management of acute osteomyelitis followed by chronicity of this osteomyelitis. One of the most important factors which lead to chronic osteomyelitis is neglected sequestrum. If sequestrum is neglected, in presence of sequestrum acts as a foreign body containing microorganisms, and the sequestrum is dead tissue, avascular. Therefore, antibiotics cannot reach to this sequestrum and the microorganism in this sequestrum. Presence of external sinus. Presence of external sinus ensures the skin around the sinus is contaminated by microorganisms, which lead to introduction of another organism into the sinus and into the bone, leading to secondary infection. Bacteria remain dormant in the sequestrum, in the fibrous tissue around the bone cavity, and in the dead tissues which are neglected. And these microorganisms remain dormant and flare at any time, leading to another acute exacerbation from one time to another. What is the microorganism leading to chronic osteomyelitis? Mixed organism, mainly as acute, Staphylococcus aureus. But another microorganism on top of Staphylococcus aureus is added as Escherichia coli, Streptococcus pyogenes, B. proteus, Pseudomonas. Pathologically in chronic osteomyelitis there are multiple irregular cavities with bone destruction containing pus, these cavities containing pus, and sequestrum. To compensate this weakness in the bone, new bone formation occur in the periphery around the cavities. This new bone formation in the subperiosteal region, as we said before in acute osteomyelitis, is called involucrum. Involucrum. Multiple openings develop in the involucrum. These openings discharging pus and sequestra. This opening is called in the involucrum. Openings develop in the involucrum called cloaca. And then pus and sequestra pass in the soft tissues as sinus on the surface. What is the complication of chronic osteomyelitis? As acute osteomyelitis, general chronic toxemia, recurrent acute exacerbation, etc. But in chronic osteomyelitis, there is chronic toxemia, and any chronic toxemia in the body inhibits the bone marrow, leading to anemia and predisposed to amyloidosis, which is replacement of vital organs by functionless amyloid tissue. The brain, the heart, the lung, the liver, the kidneys, the parenchymatous tissue in these organs replaced by functionless amyloid tissue, which predisposed to failure on all these organs. What is the clinical picture of chronic osteomyelitis? Characteristic incidence, usually boy from 5 to 15 years, and there is usually history of acute osteomyelitis and the bad management of acute osteomyelitis, no drainage, no proper antibiotic, and also there is history of recurrent acute exacerbation. General examination of this patient show poor general condition, toxemia, fever, headache. The main presentation of this patient is pain, tenderness, swelling, and thickening of the affected bone. And sure, bone has pain in this bone have the same character as acute osteomyelitis and as any bone disease, dull aching or sewing, increasing by night due to congestion, and increasing by movement due to traction of muscles on the inflamed bone. The most characteristic feature for chronicity is presence of this. What is this? It's a charging sinus. And if this sinus is closed, it breaks down again and reopened. The sinus is lined by yellowish red septic granulation tissue and it's a charging pus and sequestrum. If you introduce a probe in this sinus, the probe enter deeply. The probe enter deeply until it enter the bone cavity. Beside all this clinical picture, sure pain in this limb, leading to painful limitation of movement. Due to limitation of movement and the patient does not use his limb, disuse atrophy of the surrounding muscles occur. Sympathetic effusion may occur, as we said before, in acute osteomyelitis due to congestion, edema, and irritation in all this area in the metaphysis and in the region of the joint. This leads to increase formation of synovial fluid, which predisposes you to what is called sympathetic effusion. What is the investigation of this patient? The investigation of this patient mainly plain X-ray. Plain X-ray show the cavity which containing this white tissue, which is the sequestrum. Sequestrum, which is the dead bone, appear more white than the normal bone. Why? When you take X-ray to the normal bone, like this bone, this normal bone, we take X-ray on the bone which containing calcium, but also containing blood vessels, stromal cells, osteoblast, osteoclast, and therefore the calcium is diluted, appear this white color. But sequestrum containing calcium only. It is a dead tissue, without cells, without stroma, without blood vessels. Therefore, sequestrum appear whiter than the normal, more white than the normal bone. Followed by, surrounded by black area, which is the cavity containing pus, and the cavity and sequestrum in the periphery, there is irregular sclerosis. This irregular supraosteal new bone formation is the involucrum. This is another plain X-ray and CT scan to the central whitish bone, which is the sequestrum. The black area is the bone cavity and sequestrum separation, and the peripheral new bone formation is the involucrum. Sequestrum white, surrounded by black cavity and sequestrum separation, surrounded by white, which is supraosteal new bone formation, which is the involucrum. CT scan and MRI very important to detect any small cavities not seen in the X-ray, or small sequestrum not seen in the plain X-ray. Radioactive isotopic scanning also show any hidden foci of infection. This is a typical picture of chronic osteomyelitis. White, black, white. The central white is sequestrum. The black is the cavity and sequestrum separation. The peripheral new bone formation is the involucrum. What is treatment of this condition? General condition, sure, as acute osteomyelitis, including antibiotic, etc., and improve the general condition of the child. Treatment of chronic osteomyelitis is mainly surgical. What is surgical? Excision of the sequestrum and all dead tissue. This is called sequestrectomy. Followed by suturization. Suturization, leaving a free cavity, freely drained for the best drainage of infection. This cavity is obliterated at the end of the operation by, or the dead space is obliterated by bone chips. Post-operatively, splintage of the part in a slab to avoid pathological fracture and avoid weight bearing until regeneration of bone occur. With surgical treatment, antibiotic is taken, and also antibiotic is needed if there is acute exacerbation. This is final revision for This is a chronic osteomyelitis, sequestrum, cavity, involucrum in the peripheral new bone formation. The treatment is sequestrectomy, removal of sequestrum. Suturization, leave the cavity like a dish for free drainage, and fill the space with bone chips at the end of the operation. This is a chronic osteomyelitis. Thank you, or chronic after acute osteomyelitis. Thank you for good listening and good luck.